We're here with Dr. Teresa Frankovich for her media availability, and I know that there are just a few words you'd like to say before we get into the questions.
Again, I just wanted to restate our condolences for the family, friends, and the people who worked with the resident in Alder Bay who passed. Our thoughts are with them.
So for the media questions today, the first one is also about Alder Bay. And the reporter wants to know, have you been able to trace how the Alder Bay staff member got COVID, and can you confirm that they brought it into the assisted living facility?
So again, at this point, we are attributing the infection in the Alder Bay staff member as community transmission. However, in small communities, as we do case investigations of other cases identified, sometimes we find links between some of these chains of transmission that there was no way of knowing initially. So at this time, that's what it is. It's possible that could still change. In terms of bringing it into the assisted living facility, there's no way to actually know for certain that individual was certainly the first individual identified as having the virus.
Sure. And at Alder Bay, we know that the first positive case was the staff member. What is being done at Alder Bay and other facilities to try to reduce the chance of staff members bringing the virus into facilities?
Sure. So, there's a whole range of things that facilities do to try and avoid importing cases into facilities. And so, in general, those go to a few points. One is we can certainly work on doing some periodic screening on staff who work in some of these facilities, and actually that is occurring. However, it's important for people to remember that there's no way to screen everybody in real time. What you would love to do is to have a rapid test where you could conduct it at the door, test it immediately, and then say, go on in and work. Right now, that technology just isn't available to operate in this sort of setting. The best we can do is periodically screen, try and pick up some individuals who are asymptomatic. And so certainly what we do is to offer that up, and our Optum site allows for that. And we've been encouraging facilities to utilize it in that way. But we can never rely completely on that to protect populations. You can envision that if you are screened and you're asymptomatic and we have results for you a few days later, and in the meantime you're working, there is still that potential for exposure. That being said, it's really important for the facilities to have other protections in place. So limiting visitors, screening staff for their temperature and symptoms, making sure that staff are washing hands frequently, that are masking, and using hand sanitizer. All of those things and many other infection control practices can help keep people safe.
And what's the protocol for patients at Alder Bay? So what happens when they get COVID? How are other staff and patients protected?
So again, I think it's important to talk about facilities in general. There are more than one kind of housing facilities for people who are vulnerable in terms of medical condition or their age. So that includes skilled nursing facilities. Their position is slightly different. They're structured differently. They have different levels of clinical staff on site, and their licensing is different. Assisted living facilities are facilities such as Alder Bay, and they range in size from 1 or 2 people who are being taken care of to entities that are 20, 30, 60, 90 people on board. So they vary a bit in terms of their practices. The goal of all of these are to follow some of the things that we just talked about. Embrace the best possible infection control standards for the type of facility that you're operating, and try and make sure that you are screening employees and trying to avoid introduction into the facility.
And so one of the state's conditions for granting counties the freedom to loosen shelter restrictions is having a plan in place to quickly identify and contain outbreaks in facilities housing older Californians. Following today's news of a COVID-related death at Alder Bay, you wrote, once the virus is carried into a facility, transmission is very difficult to control. So does the county have a plan to contain outbreaks in senior housing facilities? If so, why hasn't it worked at Alder Bay?
So a couple things I'd like to point out. One is we recognize that both our skilled nursing facility populations and our assisted living populations are vulnerable populations, and protecting them is really paramount in this response. We have actually in our emergency operations center, in our operations branch, We actually have individuals working on the skilled nursing facility end as well as the assisted living end. And what we're doing in these instances is reaching out to all of these facilities, talking to them about plans they have in place, assessing their protective equipment, talking to them about contingency plans if they do have a case on site. How are they going to be able to isolate or that staff or that resident? And also, again, their plans on evaluating staff, both screening them as they come to work every day and also testing staff at intervals as a screening measure, surveillance measure. So all of that is happening. That being said, COVID is new to everyone. And all of these facilities are dealing with a pathogen that they have never had to deal with before. I am really reassured by the fact that when we're reaching out and working with these facilities, they have put thought into this. They have put planning in place. They have really tried to do what we call source control in terms of trying to avoid introducing virus into their facility and then having measures that will help halt it. All of that being said, it's very challenging. It just is by the nature of this virus. When you deal with a virus that is able to be transmitted easily before people are symptomatic, it is really problematic to get ahead of the curve in terms of preventing spread within a facility because many people may have been exposed at that point already. So it's a work in progress. We can never do enough. There's always room to do more, and that's what we're doing with these facilities. We're helping in terms of infection control consultants. We've reached out to the state and asked them to send assistance to boots on the ground to help facilities as well, and they are doing that. And so I think, again, the better we can do at controlling spread of this virus within our community, the lower risk everyone who works in healthcare and other first responder capacities, the less risk they're exposed to in terms of becoming ill or infected, and that reduces the risk for the residents of the facilities themselves. So again, I just ask all of us to work on containment in our community and following our orders and such so that we can keep a low level of transmission occurring.
And is the county working with the state to increase testing at nursing homes and other care facilities where patients are considered high risk?
We actually feel that with our Optum site, as well as the testing that we're able to do internally, that we have pretty good capacity to screen people. There is no capacity to test every employee working with a vulnerable population on a daily basis. And quite frankly, for individuals who've had the testing done, they probably would not choose to do that, and there's really no recommendation at this point for it. Typically the recommendation is to screen somewhere perhaps every 2 weeks. Some people use different criteria for that, but certainly a daily basis is not going to be doable through our current system. If the testing technology changes and we have great, fast point-of-care testing, that may look very different. But right now we have to work with the capacity that we have and the technology that we have.
And Governor Newsom is facing pressure from nursing homes / assisted living lobbyists who are wanting that industry to have immunity from civil and criminal charges related to patients contracting COVID-19. Do you think these facilities should be held accountable for preventable injuries and death?
So I am not a lawyer, and I have no way to comment on that and what all that entails. I can only tell you that in this instance, that the facilities that we're working with are very highly motivated to protect their population and to do whatever they can to keep them safe. Knowing that, as much as all of us are safe moving about in the community and trying to use all the right measures, some of us are going to become ill. And the same is true in these settings. Our goal is to minimize the number of settings that have cases, and then once they do have cases, to try and limit transmission within that facility. And that's what we can do at this point.
With the news of Humboldt County's first death, we no longer meet the epidemiological stability criteria laid out by the state to advance through stage 2 more quickly. What does this mean for Humboldt County moving forward? Will things continue to open up at the same rate, or will the process be slowed down now?
So a couple points. One is it is true, both by our case numbers per 10,000 population and the death, we would not have met this criteria had we been submitting today. I do want to point out that the state is actually amending their guidance on this point, and is actually relaxing some of these standards. So, I don't think they've issued a final on that yet, but I think it is imminent. Basically the question goes to that, how do we move forward? And what I want to point out to people is that we laid out in the plan the sort of factors and triggers that we would look at, that we are continuously looking at as we move forward to decide when it is safe to do so based on numbers of cases, the trend in cases, the doubling time, all kinds of factors, as well as our hospital status and our contact tracing capacity. So those are all factors that we're evaluating on an ongoing basis. I want to point out that the cases we've seen to date really don't reflect any changes we've made so far in terms of amending our approach to businesses opening. It's been too short a time frame to have had this impact. These are things that are happening because I think people are moving about more in our community in spite of the shelter-in-place order, and people are gathering to some extent, again, not in accordance with the shelter-in-place order, and some people are traveling for non-essential travel. Again, not compatible with our current order. And so I want to remind people that this order, our shelter-in-place order, remains in place. And even as we amend it to allow people to access businesses that are, quote, not essential, we still are asking people to limit their movement within our community, to limit their travel to essential only, if they travel, to quarantine upon return, and to really be careful about gatherings. Right now, gatherings of people outside the household unit are not permitted.
Humboldt County has had 23 new cases of COVID-19 confirmed over the past 2 weeks. How will this spike affect our soft opening and loosened restrictions on local businesses?
So this is the second part of the question that I was just talking about and hadn't really addressed, so we can talk about it here. So it's a really important point to make. I am looking at, and our deputy health officer and our team are looking at our current data. What I can tell you is right now our hospital data looks fine. Our communicable disease teams are doing fine. We still have capacity. But again, our numbers are of concern to me. We've had, as mentioned, 23 cases in the last 14 days. We have seen our row, as people refer to that, increase, and that goes to how likely it is that a case transmits to more than one other case, if at all. And we have had some clusters of cases that are larger and are still being investigated. And so we may be seeing some increase in our numbers going into this week, and it's possible that will be substantial. So I am looking at this, and we're not retracting from where we've been in terms of taking applications for businesses, the types of businesses that can apply to be approved. However, we may need to slow the certification of these businesses to match what's happening on the ground, so that we're not necessarily opening everybody at the same time, but opening gradually over a continuum based on our numbers. So we'll keep people updated.
And what impact, this is sort of similar, if any, does the current spike in cases have on decisions to approve specific businesses' reopening plans in sectors currently allowed to reopen, or decisions to allow additional sectors to reopen moving forward through stage 2?
I think we pretty much just answered that one.
In the attestation you submitted to the state, you outlined the criteria that would trigger strict mitigation measures. Can you please explain what, if any, criteria have currently been met and whether you believe mitigation measures are necessary at this time?
Well, again, as we just discussed, we're looking at those numbers. I do have concerns about some of them. None of the individual numbers in that list are enough to necessarily change what we do. We're looking at the constellation of factors. So yes, if we are concerned looking at these numbers, then again, we may slow the pace of certifying businesses, and so we slow the pace of the number opening all at once.
And is there a numeric point where increases in positive cases or more deaths might spur the county to pull back on opening up sectors? Please be specific about the numeric range.
Well, I wish I could be, but as I just mentioned, we're looking at multiple factors. We're looking at not only multiple epidemiologic factors, but our hospital capacity, hospitalization rates, and we're also looking at our contact tracing capacity, all of which can change independently or together, and can change over a period of days. And so I'm happy to discuss it as we go forward, but there is no specific number that's going to change our game.
And then finally, local casino employees received a letter over the weekend informing them that they are being asked to return to work as a casino intends to open in a week, potentially before phase 3. Do you believe that it is irresponsible and possibly dangerous?
So the answer to that question is that I am hopeful that they will reconsider. I do not think it is the right time. I am very concerned about introducing mass gatherings, even with the best of intentions in terms of being following some distancing and trying to do cleaning. It is not safe right now, and I think it has the potential to have a negative impact on our community. And I would ask them to reconsider if that is the plan.
And is there anything else you'd like to include today?
I don't think so.
Okay.
Thank you.